Senator from Arkansas.
I ask consent to end the quorum call.
Without objection.
I sat at this very desk 2 months ago during the impeachment trial where I read news, oftentimes from East Asian sources, about a viral pneumonia from an unknown virus emerging from central China. From those earliest days, I began calling for drastic measures to prevent this virus from reaching our shores and to prepare for its potential arrival. I cannot claim any special expertise. I'm not a doctor. I'm not a scientist, not an epidemiologist. But I could tell from the very beginning that the Chinese Communist Party was lying about everything related to this virus, and that we had to be prepared for the worst. That's why in January I called for a travel ban from mainland China. That's why in February I began to call for crash approvals of laboratory-developed testing kits, or the use of the kind of testing kits the World Health Organization approved or that South Korea has been using. That's why I urged a Manhattan Project level of investment in rapid testing and approval for therapeutic drugs and vaccines. That travel ban and some other measures taken has bought us some time, but an hour of great national testing has arrived. The moment of decision is upon us. The time has come for extraordinary measures. Look at what's happened to Italy just over the last 2 weeks. 2 weeks ago, Italians were enjoying early spring weather, sipping coffee and wine in restaurants and bars. Just 2 weeks ago. Today, elderly Italians are being denied care and instead administered last rites because their healthcare system is totally overloaded. It's time to take extraordinary measures to avoid that fate. What seems extreme today will seem obvious tomorrow. Here are a few of the measures whose time has come, regrettably. First, we need to stop all non-essential business activity in this country. You can call it a shutdown, you can call it a quarantine, you can call it a curfew, you can call it whatever you want. But no one should be going to work in this country unless they are involved in essential activities, groceries, pharmacies, delivering goods to those places, electricity, water, sanitation, public safety. Anything else poses too great a risk to public health. Second, it's time for non-essential government services to shut down as well, at the federal, the state, and the local level. Anyone who's involved in trying to arrest the spread of this virus or to mitigate its economic impact or provide other essential services like food aid to the needy or care for other kinds of patients at a VA hospital must come to work, and we must be prepared to work extremely long hours. But anyone else at government at any level should be telecommuting if they can and staying home in any case. Third, it's time for our military to prepare to provide defense support of civilian authorities. This is a mission the military long plans for. They are rarely called upon to do so. But an urgent hour is approaching, especially at our hospitals and our nursing homes and other healthcare facilities, when our young men and women in uniform could be called upon to support our great doctors and our nurses, to provide additional capacity to treat patients not just with this coronavirus, but with other urgent needs as well. That planning is in its infancy. It needs to accelerate immediately. Again, I know these extraordinary measures, I know they will impose hardship and pain and dislocation. But the faster we arrest the spread of this virus, the faster things can get back to normal and our economy will heal. We'll protect ourselves, we'll protect our well-being. Now, in the meantime, this Congress is going to be called upon for some pretty drastic measures as well to ensure that all those persons affected by steps taken to this day and the steps I'm calling for can make ends meet, can put food on the table and keep a roof over their head and pay their bills. So the House over the weekend passed a bill that has many important provisions that I support and I suspect could pass unanimously from this chamber. Free virus testing, provisions for school lunches for those whose schools have closed, like children all across Arkansas, liability protection for the manufacturers of respirator masks who need it so we can get millions of more masks out to doctors and nurses. But the House bill doesn't go far enough and it doesn't go fast enough. The centerpiece of the House bill in providing aid to affected workers is a new kind of tax credit for paid sick leave. Unfortunately, that's wrong-headed on both counts. First, a tax credit, even a refundable one, even one on which you can get an advance from our IRS, will not do much good if a business has no revenue whatsoever. Imagine all those restaurants, all those bars, all those gyms who are going to come to a screeching halt today or tomorrow. They will have no cash to pay their dislocated workers. They will not be sending anything to the Treasury every 3 days in the form of payroll taxes from which they can get an advance. They will have nothing. They will go bankrupt if we force them to advance sick leave with no revenue whatsoever. But also, it doesn't go far enough on the sick leave front. That is a misguided category error. Yes, we should take care of those who are sick with this virus, but there are so many others as well. Those who have merely been quarantined but are not sick, as some of our colleagues in the Senate have done. Those whose businesses are shuttered but are perfectly healthy. If they work at a bar or a restaurant or a theater or a gym. Those who have children whose school is closed and have no means to provide child care so they can get to work. They all have bills to pay as well. They all have mouths to feed. So, the House approach simply doesn't go far enough and it doesn't go fast enough to create a complicated new system that doesn't cover enough of America's workers and families. So I would suggest a better approach. We simply need to use existing systems to get cash in the hands of workers and their families as quickly as possible. So one approach is instant tax refunds or rebates, call them what you will, to anyone who filed taxes last year, especially, though, those in the lower tax brackets who are most likely to struggle to make ends meet if they're not bringing home a paycheck. That can be done almost instantly. A second approach is to use existing social welfare agencies and programs to get cash out the door into the hands of displaced workers and their families. Take unemployment insurance, for instance. The whole point of unemployment insurance is to get checks quickly into the hands of those who need it. I consulted this weekend with our state officials. I consulted today with federal officials. We don't have to redesign the unemployment system. We don't have to set new parameters and criteria in 50 different information technology systems in all our states. All we simply do is treat someone who is sick with this virus or quarantined because of potential exposure or who's furloughed from a job or who is caring for a child as if they were unemployed. The cash stipend may not be their full wage, but it'll be enough and it'll be in their hands immediately so they can feed their kids, so they can pay their bills. That can be done right now, immediately. We don't have to use employers and tax credits as a middleman or a conduit. Third, we have to think about all those businesses that are essentially going into a self-protective shutdown. All those restaurants and bars and gyms and theaters, and I suspect many more in the days ahead. They're not making payroll. They're probably cutting supplies. They still have other debts to pay, though. We should help them get through this short period of testing. whether it's loans or loan guarantees or grants, what have you. We have to remember, though, that small businesses and medium-sized businesses, when they run out of cash, they go into Chapter 7 bankruptcy. They liquidate. Those jobs don't come back. Giant businesses, when they have a cash crunch, they go into Chapter 11. Sure, the owners may change, but they come back into business. Those are just a few of the steps we have to take to mitigate the economic harm that this virus is inflicting on our people, and to ensure that no one, not a single person in this country, has any financial incentive to go to work when they're sick, or when they even may be feeling sick, or to go out and try to find another job because their workplace is shut down and they can't get any support from the government. Again, I know that these are extraordinary measures, but these are also extraordinary times. And the faster we act, the more aggressively act, the shorter these times will last. We will stop the spread of this virus. We will get our people back to work. Our markets will come back, and we will be stronger on the back end of this crisis than we were coming into it. Nothing I've said here is a Republican idea or a Democrat idea. I don't have partisan objections to what the House has proposed. I simply want to make sure that the action we take will work and will get relief to all of those displaced workers and their families in a timely fashion when they need it, to put food on the table and keep a roof over their kids' head and pay for medicine and make the car payments. That's why the Senate is here today. That should be our focus in the days ahead, and that is something we can accomplish together this week.